Honorable panel speaker, sir. Sir, this bill which is being brought, sir, and which says that to prohibit violence against medical services, persons and damage to property in Medicare service institutions and to form matters connected therewith and incidental thereto, sir. Sir, violence needs to be condemned by one and all, sir. Nobody should resort to violence, sir. Sir, but the reasons given for this introduction of this bill, and also Honorable Minister had spoken, sir. Sir, there is no reaction for no reason, sir. If there is action, then only there is a reaction. We are here protecting the doctors, sir. And at the same time, sir...
Reactions can lead to many things.
At the same time, sir, we are not concerned, we are not bothered about those poor patients who go to the hospital, in particularly the government hospital, sir. Sir, for a poor man, the only mode of treatment is the government hospitals. We are talking about protecting the doctors, sir. If the government is really sincere in protecting the doctors, first and foremost, sir, the hospitals should be well equipped with 100% infrastructure facilities, with all the teaching staff and all the equipment operational, sir. We are not talking about making hospital equipped enough with a proper manpower to tackle any such situation which arises. But instead of that, we want to bring such bills and protect the doctors and forgetting the protection of the patients who come there, sir. And I might be wrong, sir, but what I feel that, sir, one reason for this sad state of affair is that the entire medical system is built around a doctor, sir. This is really crazy, sir. Healthcare is a service industry, sir. Healthcare is a service industry and should be designed around the patient, sir. The best way of doing this would be empowering the patient with information so they know how to get the best medical care in partnership with the doctors, with their doctors. Unfortunately, sir, patient education seems to be no one's baby. As a result of which, it is a relatively neglected area. So this is a shame because the potential cost-benefit ratio is huge, sir. For the investment of small amount of money, it is possible to improve the healthcare. Millions of patients come there, they receive treatment, sir. But nobody is thinking about a poor man, sir, and about a public representative going to a hospital, sir. Sir, you are also public representative, sir. You go to a hospital, if a common man calls upon you, and why does he make a call to a public representative or to a leader, sir? With an hope and anticipation that so-and-so leader or a public representative would come for my rescue, would come there and ask the doctors to please give a proper treatment to a patient who is dying. And there have been many instances, sir. Sir, through you I would like to also know from the Honorable Minister, sir, can she give me the figures, sir, of the total birth per day in all the government hospitals and total death per day in all the government hospitals? Why are people dying there, sir? Like in this bill says that if I go there, if my electrodes call me, I go there, and what happens, sir? I'm not supposed to ask doctor anything. Whether right or wrong, he'll go and lodge a complaint against me. The moment he lodges a complaint, action could be taken against me. What about the patient, sir? What about the poor man coming to the hospital? Who's going to take care of that poor man who comes with a hope, sir? And we all, sir, it is not that we are against the medical fraternity, sir. My party is not against the medical fraternity, sir. As you all know, sir, under the Darussalam Education Trust, sir, our trust runs Not one, sir. Our trust run two big major hospitals, sir. One is a super specialty hospital, one is a general hospital with all broad specialities. And we also run 5 health centers, sir, and 3 hospitals with 25 beds. We also run hospitals at Hindupur, at Nizamabad. We run hospitals at Kadapa also, sir, and also Kadri, sir, and in Hyderabad, Hakimpet, Talabkatta, so many areas we run hospitals, sir. But, sir, this particular bill is arbitrary and unwarranted, sir. One-sided and a bad piece of legislation, sir. It has omnibus provision and definition, sir. The medical service institutions have been defined to include a private medical institution also, sir. The definition of Medicare service person includes medical and nursing students and paramedical workers, sir. Similarly, often does any person who may include an elective representative as the bill defines a member or a leader of group of person organization. Definition of violence includes even intimidation, obstruction or hindrance to any medical service person, sir. The penalty are also heavy and disproportionate as the bill provides for imprisonment of period of 3 years with a fine up to 50,000. Moreover, the bill has a draconian provision which makes the offense cognizable and non-bailable, sir. It's a very sad, sir. Therefore, this bill cannot be passed by this House in its present form. Most important, the bill doesn't incorporate any provision for redressal of grievance of patient and their attendance against the doctors, nurses, paramedical staff and medical and nursing students for negligence, not attending to patient in time and not providing proper treatment to the patient, sir. The CM had promised to consider grievance redressal mechanism for patients in their attendance, but the bill solely lacks any provision against doctors for the negligence, sir. So when the ordinance was brought, sir, Honorable Chief Minister has promised about this, that a grievance redressal mechanism for patients and their attendance, but the bill doesn't say a single word about this, sir. Sir, it also has strict provisions to prevent attacks on intimidating acts against the medical fraternity, sir. But, sir, the government is yet to spell out the composition and powers of redressal authority also, including representatives of local elected private medical establishments are apparently left out, sir. Why are the private institutions left out, sir? What about the private-run medical hospitals, sir, medical colleges, hospitals, sir? They have been left out with this, sir. So I therefore request all the political parties, sir, strongly oppose this draconian one-sided black legislation as it gives doctors and another medical personnel the license to kill, sir.
Yes.
I demand that on behalf of the party, AIMIM, that this bill should be referred to select committee or assembly so that enough safeguards are provided to the patients against the criminal negligence of the doctors and other medical personnel. This bill should be incorporated a grievance redressal mechanism to patient and the attendants in all the hospitals, sir.
Yes. Kishan